What types of claims are we going to see, or are we seeing? Well, firstly, of course, obviously, diagnosis related. Was there a failure to diagnose a positive COVID-19 person? And also, when we talk about treatment related, negligence in the treatment itself, but also delay in treatment or refusal to treat someone who has tested positive for COVID-19. Additionally, we'll see claims related to the failure to administer or the improper administration of the COVID-19 vaccine. Also, community spread to patients, family members in clinical settings, office settings, hospital settings, etc. Additionally, we'll see claims related to exposure to COVID-19 directly from a provider who has tested positive for COVID-19. And also failure of the medical provider to follow established government guidelines related to the treatment of COVID-19 patients, but also the treatment of patients in general and how their offices are protecting people from being exposed to COVID-19. Additionally, we're going to see claims related to lack of facility capacity or access to medical equipment. We saw a lot of that last year where hospitals were at or near full capacity and there was a challenge to get medical equipment such as ventilators. We'll also see claims related to understaffing and untrained staff treating people with COVID-19 or as a result exposing people to COVID-19. Additionally, there's been a great deal of telemedicine which has taken place since the beginning of the pandemic. And there may be claims related to failure to properly diagnose certain things that could have been diagnosed in person, but were done remotely and in fact not diagnosed. Additionally, we expect to see claims related to lack of informed consent, off-label experimental drug use, for example, by people who have chosen not to take any of the 3 available vaccines, but want to try alternative methods in order to fight the vaccine, and the medical provider who may provide those off-label or experimental drug uses. Additionally, we expect to see discrimination cases filed related to providing of things like medical equipment and facilities in more underprivileged areas. And finally, the one that's going to allow the most litigation to continue forward is willful conduct, where there's an allegation of gross negligence or intentional harm